Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Markham.
Hello, I'm Dr. Tim Jennings, sitting in for Dr. Jim Markham. Welcome to Heart of Health Live, your weekly place for healing truth and grace. Each week on Heart of Health Live, we bring you medical professionals who understand the importance of integrating the latest in scientific understanding with the truth of God's principles of love to promote healing of the whole person, biological, psychological, social, and spiritual. And unlike other shows, on this show, you can be part of the program by calling 855-644-3278. That's 855-644-3278, and ask your questions of our guest. And today, we will be talking with a doctor who treats children and specializes in treating the part of your body that compromises 14% of your body's total normal weight and is composed of 270 individual parts. It's the part of the body that protects your internal organs, anchors your muscles, and produces blood. Have you guessed it? Yes, we're talking about your bones. Bones are strengthened by calcium, vitamin D, and exercise. Bones are weakened by lack of exercise and nutritional deficiency. But bones can also be damaged by trauma. According to the Journal of American Medical Association, the frequency of childhood forearm fractures has steadily increased in the United States from 1969 until 2001. In boys, forearm fracture rate increased by 32% and 56% for girls during the same time period. The ages for the greatest likelihood of forearm fracture is 8 to 11 in girls and 11 to 14 in boys. But fortunately, your bones are not like the dry white skeletons seen in a museum. Bones are living tissues that grow and regenerate throughout your life. If a bone is broken, it can regrow new bone, and bones contain bone marrow from which our blood is produced. During today's show, if you have questions about bones, bone disease, when to choose surgery over casting, different types of casts, how to care for a cast, scoliosis and scoliosis treatment, club foot treatment, questions about bone lengthening, or what we used to call pigeon toeing, now called in toeing or out toeing, or other questions about bones or childhood bone development, give us a call at 855-644-3278. That's 855-644-3278. We'll be back after this.
The Heart of Health Live will return in just a moment.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't, because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
I'm Dr. James Markham with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thicken, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Markham is doing in your area, visit heartwiseministries.org.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. I'm Dr. Tim Jennings, sitting in for Dr. Jim Markham. And today, we're going to be talking with a specialist who treats children and specifically childhood bone disease. If you have questions that you'd like to ask our guest, our phone number is 855-644-3278. Let me introduce our guest tonight. This is Dr. Wendell Moses. Dr. Moses, welcome to our show.
Glad to be here.
Now, tell us a little about you, your background. Where'd you go to school? Where'd you do your training?
I'm a pediatric orthopedic surgeon. I trained in Southern California for medical school and residency. Spent 10 years there. And after a brief time there working in a trauma center, I moved to North Carolina and was there for 18 years. Moved to Chattanooga about 6 years ago.
And where do you work here in Chattanooga? What do you do in Chattanooga?
I work at T.C. Thompson Children's Hospital, the Children's Hospital at Erlanger.
Right.
And I work with a whole team there for just children's orthopedics.
Well, tell us a little about what is orthopedics?
Bones, joints, and muscles. So anything that makes you move and keeps you upright or gets you to do what you want to do, that's orthopedics.
Okay. Now, I understand you're also a Christian.
Yes.
Do you see any parallels between Christianity and medicine?
Well, we use what God has given us. God's universe is based on His love and His laws of structure, and everything I do is dependent on that working.
Well, tell us about the most common orthopedic conditions that you treat.
Half of what I do is take care of broken bones. So if a child comes in the emergency room and then gets a cast or gets his bone straightened or whatever, and then he'll come to our office for follow-up care. Or in the case of a growth injury, an injury to the growth plate or something that's going to alter his growth, then we may need to surgically alter how it grows so that it takes care of the injury that's happened.
Now, what are the most common types of breaks that you see? Or is it just everything all over the board?
Some things are more common. In little children, it's elbows.
Really?
We have to fix broken elbows fairly commonly. In older children, it's broken wrists and broken knees and broken ankles. Football season is a very busy time for us.
Oh, really?
If football were a toy, it'd probably be outlawed, but I like to watch football, so I can't speak too badly about it.
You see mostly like the knee injuries like the pros get? Is that what you see?
Ankle injuries, forearm fractures, wrist fractures, very common.
And so the age range that you treat children from what age to what age?
From birth, or even consultations before birth for pregnant women.
Really?
Or up to 18 years of age generally, unless a person has a syndromic disease that causes them to grow abnormally. And those conditions continue on until they're adults into later life. And sometimes that is a condition that a general orthopedic surgeon would not treat and that I would treat.
Now, do children ever suffer from hip problems?
That can start from birth problems for whenever the hips are out of position when they're born, to children who have cerebral palsy, who the hips grow out of joint, to children who have blood vessel problems to their hips when they're young children.
Now you don't put pins and things in children's hips, do you?
Oh, you bet.
Really?
You bet.
Okay, you brought something to show us today.
Okay, so if you're an adult and you break your hip, you may have to have your hip ball connected to the thigh bone, and they'd use a metal plate and bolt similar to what I'm holding.
That's the size of an adult.
This is
for an adult.
This is a size for an adult.
Okay.
Okay.
And what about a child?
A child who is probably 5 to 8 years of age would have something this size.
And
okay. And then Tuesday, I took something out of a 1-year-old who we had to fix for this size.
Wow.
So looking at the various size, it kind of markedly goes down in size.
That's amazing. And that pin won't actually affect the growth of the bone when you have it in a child's bone?
If it's put in right.
If it's put in right.
So that's one of the biggest issues between children and adults is you cannot put in this bolt like you do this bolt, otherwise you'll ruin their growth.
I'm Dr. Tim Jennings, speaking with Dr. Wendell Moses, orthopedic surgeon for children, pediatric orthopedic surgeon. If you have questions, give us a call at 855-644-3278. That's 855-644-3278. We'll be back right after this.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing? I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Nice. No. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. I'm Dr. Tim Jennings, sitting in for Dr. Jim Markham, and we've got Dr. Wendell Moses, a pediatric orthopedic surgeon, with us today. And if you've got questions, give us a call at 855-644-3278. That's 855-644-3278. Dr. Moses, we were talking about hips, and I noticed in the break that you had a little model that you wanted to show us because something to do with hips. What's this going on here?
Okay, so if your child would have a hip that was dislocated at birth, and we could not treat it appropriately with a brace, which is 90% of the time, we might surgically have to take the child to the operating room, put the hip into the joint, and then put them into a body cast, very similar to this.
Oh my goodness. Now let's turn that cast around where the camera can see this. This is actually very firm. They can't bend in this thing, can they?
No.
No.
So this is a model that we use to show parents, to show what it's going to look like after the surgery. And then we also have to teach them how to take care of the necessary diapering. And
yeah, I'm thinking this is going to be a mess right here. This is not going to be pretty.
If you've ever been a parent, you can know that this is not going to be an easy thing.
Yes.
And
so how often you got? I mean, they put them in the cast, you send them home. Babies are going like many times a day. How long does that cast hold up before you got to recast it?
Well, the cast typically stays on for 3 months after a surgery like that.
That doesn't get nasty?
And during that time, you may need to, because the baby's growing.
Yeah,
and they grow out of the size of the cast.
Ah, okay. So they will change the cast.
So you'll change the cast anywhere from once or twice during that 3 months.
Do you give them any special like antiseptics or anything to help keep that cast clean?
No, there's instructions and there's certain techniques.
Can the cast get put in water?
No.
Oh, we can't?
No.
I thought they had casts these days that you kids go swimming. I see kids swimming with casts on. What's the deal here?
Certain casts you can get wet, but those typically are not in a lot of corners where it's going to stay wet.
Okay.
Because if it stays wet underneath this cast, the skin is going to rot.
Ah, yeah, that's no good.
You're going to get a yeast infection, you're going to get skin breakdown, you're going to get sores and whatnot.
No good.
And so no one is very happy about having to use a cast like we are using here.
This baby's not a happy camper.
No.
Now,
mother's not happy.
3 months in this?
3 months.
Now, the hip that's not injured is in that same thing too for 3 months, right?
Correct.
So don't they get like hip stiffness, muscle atrophy, all these kinds of things happening?
If you or I had a hip fracture and we were fixed, then you needed to go to physical therapy, get moving quickly and everything else. You turn these children loose and they go. And they will do their own therapy. Okay?
So as soon as you take them out of it?
They are starting to move immediately.
Okay, so, but the other hip doesn't get any type of loss of range of motion or anything like that? They're flexible?
It does get stiff, but they quickly get it back.
They quickly get it back. Okay. Kids are resilient. Kids are resilient.
Kids are very resilient.
Okay.
If a child were to break their thigh bone, their femur,
yes,
you would also put them in a cast very similar to this, and the cast would only stay on for a month or 2 at most.
Because the bones really are regrowing really fast.
They're growing very fast. It heals very fast. The bone is healing.
Well, since we're talking about kids and kids' bones right now, let's briefly talk about rickets.
Okay.
Tell me about rickets. What is it, and how? And because parents need to know how to keep their kids' bones healthy, kids' bones strong, kids' bones growing strong. So tell us about rickets and what is it, and how do they avoid it?
Rickets is the worst form of vitamin D deficiency.
And what happens?
The growth plate where the bones grow do not grow properly. It becomes painful. It makes the bones curve, and
it happens because
either they have an enzyme that doesn't take care of vitamin D, or they are not getting enough vitamin D in their diet and exercise outside with sunlight. So across America, there's an epidemic going on right now of vitamin D deficiency.
Because parents aren't getting enough pills in the nutrition store to give their kids?
Because children are playing video games, they're not playing outside. When I grew up, I had to play outside. We lived in a small house and we played outside. Now with video games, we're constantly doing this inside or with a TV or whatever. And so the skin is not making the vitamin D properly.
And so what can that do to kids? And if they're playing inside all the time, not getting the vitamin D, what's going to happen?
Children come in all the time with bone pain, with arm pain, leg pain, knee pain, and it's often because they don't have enough vitamin D.
So parents need to be taking their kids' video games away, at least some of the time, and making them play a couple hours. How much sun? An hour a day?
Doesn't need that much. It's just a few minutes.
So just a few minutes a day, and it'll be enough vitamin D, and we're having a vitamin D deficiency, so these kids aren't even getting a few minutes a day. This is great stuff, Dr. Moses. We're going to be back right after this break. If you've got a question for Dr. Moses, you give us a call, 855-644-3278. That's 855-644-3278. We'll be back right after this.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Markham is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Markham dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
I'm Dr. James Markham with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thicken, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Markham is doing in your area, visit heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. I'm Dr. Tim Jennings, sitting in for Dr. Jim Markham. We've got our guest, Dr. Wendell Moses, a pediatric orthopedic surgeon with us today. So if you've got questions about bones or bone illnesses, bone treatments, give us a call at 855-644-3278. That's 855-644-3278. Dr. Moses, tell us what is club foot? And we've heard this term, people talk about it, but what is it? How do you get it? And what do you do about it?
Club foot is a genetic condition.
Really?
That happens unexpectedly usually to a child in utero before they're born, and the foot is actually very deformed. If you have a club foot model like this, shows kind of what the foot looks like.
Turn it where they can see that.
And so if this is the knee, the foot is wrapped up, and often the bottom of the foot is actually pointing up.
Oh, really?
So when the child is born, the foot is very rigid, it's deformed, it's stiff, and it's our job to make it so that it will function well and they'll have a good outcome.
So when you say it's rigid and stiff, is it because there's a fusion of the bones that make up the ankle, or what's going on there?
The muscles that come down are not functioning well.
I see.
The nerves are not working well, and so the foot is pulled up in this abnormal position by the tendons and the muscles being too short.
Okay, what do you do about that?
Well, the whole nation did the wrong thing about 15 years ago, and for ages. We did surgery. It used to be my most common surgery. And yet now, we fairly firmly believe that you should seldom do surgery in the classic way of fixing this foot. What we do is we take a foot like this and stretch a little bit, try to get rid of some of the position that it's in, put it in a cast in that position. The next week, the parents take the cast off at home, come back in the next week, and gradually, as we do this, we have foot models here that we transform, and we go from the foot that we showed you, which was quite crooked, to a foot that's straighter, and then eventually it looks like a normal foot.
And you do this through casting and just basically allowing the things to be stretched slowly.
Slowly stretch, and then the muscles start working better. And so when we finish, we end up with a foot that is flexible and usable, and they can then walk on this and do very well. The downside of this is that parents need to continue to brace the child's feet for several years, and that's a
because it'll go back if they don't?
It will grow back.
Interesting. Now, the surgery they used to do, would they cut the tendons and muscles, or what would they do?
Essentially, you dismantled the foot into its parts, put it like it should be, and pinned it, and then held it in that way until it was healed. And then you put it, they started their life without having to have a cast or brace or anything on. The problem with that is the bones don't grow normally.
Which bones? Foot bones, ankle bones, leg bones?
The foot bones didn't grow normally. They became very stiff, and in half of the time, the foot became painful as an adult.
Ah, okay.
So
with this, have they been doing this long enough that people have actually grown into adulthood from this treatment?
Correct.
And how do they do as adults?
They do very well. 80% of them, so 4 out of 5, do very well, have a normal functioning foot. The neighbors don't know anything's wrong. They can play sports, they can walk, they can do activities and do very well.
How common is this? If you have 1,000 births, 100 births, we'll give us some. How common is this?
It's probably 1 to 5 in 1,000.
Okay.
Fairly common.
Fairly common, yeah.
It's one of our most common birth defects we have.
And you say this is genetic.
Genetic.
Is this like autosomal recessive, or what is this?
It's not been completely worked out yet. In some families, the children have it quite frequently. In other families, it's very rare. So it's probably multifactorial.
And there's no known environmental thing, like a woman who's pregnant gets exposed to a toxin or an infection or something that would cause this?
We know of no thing that the parents are doing wrong. It's just bad luck.
Well, I didn't say parents are doing wrong. They just got exposed to something, a toxin, an infection, these types of things. But nothing like that's going on. Do parents sometimes express like maybe they're worried that they did something wrong?
Oh, they're very concerned.
Yeah.
But we, in the office environment, we show other parents who are doing well and show them how to do it.
I'm Dr. Tim Jennings with Dr. Wendell Moses, a pediatric orthopedic surgeon, on Heart of Health Live. If you've got a question, give us a call at 855-644-3278. That's 855-644-3278. We'll be back right after this.
The Heart of Health Live will return in just a moment.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. Hi, I'm Dr. Tim Jennings, sitting in for Dr. Jim Markham. Welcome back to Heart of Health Live. If you've got questions, give us a call at 855-644-3278. We're speaking with Dr. Wendell Moses, a board-certified pediatric orthopedic surgeon. Dr. Moses, tell us about scoliosis. What is scoliosis and what do you do about it?
Scoliosis is curvature of the spine sideways. And
okay, so curvature like this is what?
Kyphosis.
Kyphosis. That's like the little old granny who kind of gets like this. That's kyphosis, okay? It can happen from age?
Age or some pathologic problem with how the bones grow.
Okay, and then scoliosis, you'll be standing up like this, but it's kind of like this, right?
Correct. It's curved sideways.
Okay, and what's the problem with it? Why is that a problem? Who cares?
Well, if it curves enough, it can limit how well you can breathe.
Why can that limit how you can breathe?
Because if your spine is so curved, it makes the ribs wrap around and flatten down, and so there's less room for the lungs.
Okay, so when we breathe, our ribs are actually moving up and down.
Right.
And so if the spine curves, then it kind of prevents that up and down movement, so you can't. It's like a balloon can't expand anymore.
And if you took a cage and twisted it, it would make it narrower.
Ah, okay. So when it's not just a curving of the spine sideways, it's a curving and often twisting too.
Correct. It's a rotation and curving sideways.
Okay. Now, what do you do for somebody who's got that problem?
If it's very mild, you don't do anything. The vast majority, 4 in 100 of children will have a curvature of some kind.
4 out of 100. That's pretty good number.
So those you don't do anything with because it's mild, doesn't cause a problem. You don't even notice it unless you're actually looking for it as a physician or something like that. And if it's mild, you don't do anything. If it's getting more severe, if it's very severe, you want to do surgery and prevent this from happening and get their lungs working better and make sure that cosmetics is better.
Now many, many years ago, in a galaxy far, far away, back when I was young, I used to coach little league softball, basically, for kids in elementary school. And we had a young man on our team, a young boy who was in 7th grade, who had really bad scoliosis. And he went down to Erlanger, and he got Harrington rods. What are Harrington rods?
Dr. Harrington was the first orthopedic surgeon to actually invent a telescoping rod that could be put into the spine to help surgically correct scoliosis reliably.
So put into the spine, you mean they actually put a rod that goes down through the vertebrae of the spine?
On the outside, on the back of the vertebrae.
Oh, on the back of the vertebrae. How do they hook it to them?
Well, Harrington invented some hooks that would hook into the bone. Now we use screws that actually screw into the bone. It's much more reliable, much more reproducible, and you can get more correction. You can even correct rotation as well as the curve.
So he kind of came to this idea, and then of course it was improved, modified on.
Right.
So what's the latest deal on if you get the severe form of scoliosis? What's the latest surgical intervention? What do they do?
They typically will straighten the spine by taking out small parts of bone to allow it to bend easier, and then to put in the rods, very similar to what we were just talking about, and putting in screws in that lock that into place.
Do we have a caller? Do we have a caller, guys? I can't read the name. Who's the name? Is that Don? Doc. Hey, Doc in Indiana. Welcome to the show. I'm Dr. Tim Jennings, sitting for Dr. Jim Markham. This is Dr. Wendell Moses. Welcome to our show. Hello? Caller on the air? We got him? No?
Hello.
Hello, hey, hello, welcome to the show.
I have a question about if you're really fatigued, can that hurt your heart muscle?
If you're really what?
Hello?
Yes.
Hello.
What's your question?
If you're fatigued and not get much sleep, can that hurt your heart muscle?
That's really a question for Dr. Markham, who's our cardiologist, who isn't here tonight. We've got an orthopedic surgeon and a psychiatrist tonight, but we may be able to give a little advice. You want to try that one?
I don't think so.
No. Okay. So no, that's a great question. I encourage you to call back next week and ask Dr. Markham, who's a cardiologist, at the same phone number at the same time next week, and you're going to get a great answer to that question. Thanks for giving us a call this week. Okay. So if you've got a question for Dr. Wendell Moses, our orthopedic surgeon, and you'd like to get on the air tonight with him, give us a call at 855-644-3278. That's 855-644-3278. And we'll be back right after this.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Markham is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Markham dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Hello, I'm Dr. Tim Jennings, sitting in for Dr. Jim Markham, and welcome back to Heart of Health Live. We're speaking with Dr. Wendell Moses, a board-certified pediatric orthopedic surgeon. If you've got a question you'd like to ask Dr. Moses tonight, give us a call at 855-644-3278. Dr. Moses, you've got something on the table there. It looks kind of weird. What's going on with this?
This is a pump which is used to store medicine. It's put in a person's abdomen, and then a little tube runs from the pump around to their spine, and then the little tube goes into the spinal canal area, and it puts medicine in to help relax spasticity.
Okay, spasticity means?
High tone. So if you imagine someone who's had a stroke, or someone who's had cerebral palsy, and their muscles are too tight, they can put either take some medicine by mouth.
Right.
The problem with that is by the time they get enough medicine in,
they're sedated.
They're sedated.
They're sluggish or sleepy. Right. Can't do anything. Okay, right. Gotcha.
So if you put in 100th of that dose directly into where the nerves go, where you're wanting it to act, then it will relax the spasticity, help them get dressed easier, help them in walking better.
Okay. So let's see if we understand what you're saying correctly. You're saying you make a surgical incision into the abdomen, and you insert this pump inside their body.
Correct.
And then you run a tube inside their body, around to where the spinal cord is, and you put a little injector port. So you got, instead of a fuel injector, it's a drug injector. It's going to inject it right into the nerve areas where you want to hit, and this little pump is going to inject this little medicine right into those nerves.
That's correct, and not only that, but they can alter by programming this pump, just like you'd program
Wait a minute, there's a computer chip in there somewhere?
There's a computer in there, and a battery that lasts 7 years.
Okay, how much medicine can you get in one of those pumps?
This holds only about 2 tablespoons.
And how long will 2 tablespoons last?
It depends on how much you have to use for your thing. Anywhere from a month to 6 months.
Okay, and so the battery lasts for 7 years, but your gas tank's empty in 6 months. What do you do?
There's a little port there. And
I see that.
You numb up their skin.
Uh-huh.
And then you stick a needle in and squirt in more medicine and fill up the tank.
No, hey, we got to stop at the gas station. We got to stop at the med station. Get filled up my port. You're
Correct.
kidding me, right?
Correct.
How do they program it? Is it like how can they communicate with this thing that's inside the body?
Very similar to like they program a pacemaker that's inside your body. A electronic gadget will talk to it and tell it to, I want more medicine in the afternoon when I'm really tight, and less medicine at night when I'm asleep and I don't need it.
Now, what happens if somebody's got one of these and goes through the security at the airport? Is it going to set it off?
Probably so.
Is that magnetic metal? Can they go in an MRI with that?
They can go in an MRI.
So it's not magnetizable metal?
No, but they may have to restart the medication and check the program after they get through with the MRI just to make sure.
That's pretty cool. That's pretty cool. So they're really high tech with this stuff.
Yes, very high tech.
How often do you do something like this?
Probably I either refer someone to someone else or I do it myself, probably once every 2 to 3 months.
And is this similar to when some people go in for a pain pump and they get a similar type thing, except they're just pumping pain medicine in rather than muscle relaxing medicine?
Yes, very similar. Very similar.
Very similar. Okay. Alrighty. Tell us about the old pigeon toeing. What's pigeon toeing?
Pigeon toeing is when you walk, your toes point in toward each other.
Okay.
And when we are all inside mama, we're wrapped up so that we can fit inside mom.
Right.
And then when we are born, we unwrap.
Right.
And that process takes about 12 years or so.
To unwrap?
Yeah.
Okay, so do most people with pigeon toeing just automatically do it on their own, or do some people have to have help with that?
90% unwrap on their own, never have to have anything done, no surgery, no special shoes. When my sister was small, she wore special shoes and braces until she was an older child. But we found out through recent research that that has no effect whatsoever. And so what my sister went through had no effect on her at all. My mother and father spent a lot of money on special shoes and braces that they did not need to use.
In very few seconds, what about out-toeing, which is the opposite of in-toeing, pigeon toeing, the out-toeing? What about that?
Less common, same problem.
It's from being inside mom?
Yes.
Same thing?
Yeah.
And it just undoes it on its own?
Yes.
Okay. Well, we're talking to Dr. Wendell Moses, board-certified pediatric surgeon working here in Chattanooga, Tennessee. I'm Dr. Tim Jennings, sitting for Dr. Jim Markham at Heart of Health Live. If you've got some questions you'd like to ask our guest today, we've got a segment coming up. You've got time for your question. Give us a call at 855-644-3278. That's 855-644-3278, and we'll take your question on the air. We'll be back right after this.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have healing?
Nice. No. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Hello, welcome back to Heart of Health Live. I'm Dr. Tim Jennings, sitting in for Dr. Jim Markham. We've got a guest tonight, Dr. Wendell Moses, a pediatric orthopedic surgeon. If you've got a question, give us a call at 855-644-3278. And we're going to the phones. Hello, Larry from Kentucky. Welcome to the show. You've got a question for us? Larry, you there from Kentucky?
Yes, sir. Can you hear me?
Yes, okay. Go ahead, Larry. You're on with Dr. Moses.
Hello?
Yes, Larry,
Yes,
you're
can
on
you
with
hear me,
Dr.
sir?
Moses. What's your question?
I'm here.
Hello? I guess we're having trouble with our telephone lines.
Yes, sir. I had an MRI done on my left knee, and it showed that I had arthritis in the front of my knee.
Are you there, Larry?
And in the back of my knee, I have like a cyst, and I'm just trying to get suggestions on what I should do about it, if I need surgery or what I need, you know.
Without seeing the MRI, obviously it's very difficult to make a judgment about that. Arthritis in the front part of the knee where the kneecap is very common. And as a secondary effect, you often will get a cyst in the back of your knee. So those two go together. So someone should go to an orthopedic surgeon who is qualified to take care of worn knee joints. So for an adult orthopedic surgeon who does a general practice, who often will be able to take care of that.
Now, I know you can't give a specific recommendation, but could you tell us what are the general types of interventions people can do for this type of problem?
Generally, depending upon his age, will make a big difference. Also, if everything is lined up correctly. If it's crooked, then obviously that needs to be straightened to unload some of the forces there.
Okay.
But if it's a matter of being worn out, then he may actually need a knee replacement, although that's a far cry from being able to tell what's happening at this point.
Sure, sure. Thanks for calling, Larry. We appreciate your telephone call.
An adult orthopedic surgeon, though, would be his best bet.
Well, tell us about what bow-legging is.
Bow-legging is where typically the top part of the shin bone or the tibia is bent. And most commonly it's bent because it's not grown properly.
And what contributes to that problem?
The two major things is a child who is large for his age and he walks too early.
Now, are you speaking about obesity?
Obesity is a common, the most common thing, but many children, we like to see our children healthy, and in certain families they say, oh, that looks just like Uncle Fred and he's large.
Okay.
But if he's large at a very young age and he walks, before a year of age.
Before what?
Before a year of age.
Before 12 months of age.
Yeah.
So walking before 12 months of age puts the child at risk for having bow legs.
Correct.
I did not know that. Because the tibia bones, the bones of the shin bone, are not, or they're more cartilaginous than they are bone at that point.
As we previously talked about in towing, the combination of in towing, which 90% of us have, combined with walking on it too early, will put too much pressure on the growth plate.
Okay.
And the growth plate then gets damaged.
It starts growing this way.
And grows crooked.
I gotcha. All righty, that's no good. So what do you do for that type of problem?
If the problem is severe, then you end up having to do surgery. Sometimes you can just alter how it grows. So slow down the outside of the growth plate, let the inside grow, and it will grow faster, and it will straighten back out.
What is this thing?
This thing is a frame which if you have a crooked knee, you can take and put this on so that it matches the deformity, and then you lock everything into place so that you have pins that go into the bone. Your leg is on the inside of here. You cut the bone, and then you dial up a computer program. And the computer program tells you every day how to turn these struts to alter so that it straightens back up.
Cool.
And then once it's straight, you let the bone heal, and you now have a straight bone.
And I imagine with that thing, you can actually just stretch a bone and lengthen a bone too.
Very, very commonly done.
Now that's pretty cool. That's pretty cool. Now, do you do that very often?
Several times a year.
Several times a year. How long do they have to keep that on?
3 to 6 months.
And is it prone to infection?
Yes.
Because you have pins going from the outside to the inside. You got to be very diligent and vigilant, keeping ointments and stuff on that.
Correct.
Yeah. All right. Dr. Tim Jennings here for Dr. Jim Markham, speaking with Dr. Wendell Moses, a pediatric orthopedic surgeon at Heart of Health Live. If you have a question, give us a call, 855-644-3278, 855-644-3278. We'll be back right after this.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Hello, I'm Dr. Tim Jennings, sitting in for Dr. Jim Markham, and welcome back to Heart of Health Live. Okay, we're with Dr. Wendell Moses, pediatric orthopedic surgeon. The most important question of the night. Tell me about that bow tie. Why do you wear that bow tie anyway?
So kids won't grab a hold of it when I'm bending over and do an exam. And also, when I'm putting on a cast, I don't have to tuck in a long tie. It's up out of the way. And
you should actually put casts on still.
Yes.
Now, cast still with plaster?
Plaster for club fit.
Okay.
Almost the only club foot or the plaster cast we put on anymore is club foot cast. Now, in the emergency room, we may put on plaster for a splint or temporary cast, but now it's fiberglass.
And fiberglass, so what are you wearing gloves when you do this?
Oh, yes.
Okay,
yes.
And is it like epoxy smelling?
It ruins your shirt, and the colors are good. But it's great. We have all different colors. We have all different designs. You can have teddy bears or doggy prints on your cast.
So they love that.
Yeah.
All right.
We even have glow in the dark.
All right, in our last minute, tell us about brittle bone disease, and what is it? What do you do about it?
Brittle bone disease is inherited. It's a genetic defect of varying amounts, and in the severest form can actually be lethal. But we often use medications now to help reduce the number of fractures we have.
What in the bone is the problem? There's too much calcium, not enough magnesium. I mean, why is the bone so brittle?
The protein structure that the calcium attaches to is the wrong rope length. If you imagine you had a big long rope that's strong, but if you were making something with little tiny short segments of rope,
yes,
it would not be very strong.
Okay, so that's what's happening. So so the bones will snap and break much easier.
Yes.
Okay. All right, we have been enjoying our hour with Dr. Wendell Moses, a board-certified pediatric orthopedic surgeon. If you have questions that you would like, then write down the number 855-644-3278 and check back with us next week, because we will be back with another medical professional 1 week from today, live 6 to 7 with Heart of Health Live, and each week we will get a new opportunity to ask new questions to a new healthcare professional. We appreciate you being with part of our show tonight. I'm Dr. Tim Jennings, sitting in for Dr. Jim Markham, and we want to again thank Dr. Wendell Moses for being with us tonight. Check with us again next week, and thanks for being part of our show.